Hi, everyone. Good morning. Good afternoon. This is Jen Lee from the Association of Asian Pacific Community Health Organizations. Just want to welcome you to our sort of combined today. We have our monthly Civic Engagement Coordinators call and then our policy briefing presentation, which our policy staff, Heather Skrabak, will be doing shortly. Just wanted to remind folks that if you could mute your lines while we're going through the presentations, but also this is not like a formal presentation, so if you have questions, just feel free to unmute and jump in and ask those as we've done on calls in the past. But super excited to talk to you guys today and also give you some updates as we prepare to all meet in DC in just a little bit more than a week. We've been in touch with most of you over logistics, and really thank you for your patience on that front and giving us all the updates on everyone who's coming. So we have a really great group of, I think, about 36 attendees from all the health centers coming. So I'm particularly excited to see you all face to face and hear about all the great work you're doing. So just our agenda for today's call, we're going to be, I have a few just updates and reminders in preparation for our convening in May. And then I'm going to turn it over to Heather for our AAPCHO on the Hill presentation. So she'll be going over some the key policy agenda that we're bringing to our congressional members in DC, and have time for you all to ask questions about that and tell you how we're going to help also continue to support your preparation for DC while we are on site there. So I'll just get started because I want to make sure there's enough time for Heather. I know in the documents you've received to date, you didn't have a detailed agenda for what Monday our convening is actually going to look like. So thank you for your patience, but this is kind of the unveiling, and then I'll be sending a revised kind of schedule of events that includes this detailed agenda to you all early next week. But for Monday morning, so we actually have confirmed, and I wanted to let everyone know on the phone, and we'll email this out after this call as well, that we, because of the amount of content that we have going on Monday, we've asked to move the start time to 9 a.m. versus 10 a.m. and appreciate your accommodation around that. I think we've spoken to everyone who was intending to travel on Monday morning to be able to adjust to this new start time. So we'll be having breakfast from 8 to 9, and we'll update that on your schedules. But we'll have an early start, so I hope everyone's okay who's coming in late the night before. We'll have lots of coffee. But we're going to be kicking off the morning with, of course, introductions to the group, so you get a chance to see who's in the room. There will be several consultants as well as members from the Wallace H. Coulter Foundation present during the convening. I think many of you know Sue Van, the CEO of the foundation, and then Susie Sands, who's also sort of the portfolio lead for the Civic Engagement Project, will be there, as well as Dennis Van. And our morning presentation, a few of you had a sneak peek of this in DC in March, but Karthik Ramakrishnan is going to be doing an opening presentation on API Civic Engagement, Past, Present, and Future. He also happens to not only be Professor and Associate Dean at UC, UC Riverside, sorry, I left that out, School of Public Policy, but he also runs the data website, apidata.com. So, sorry, could someone mute their line? Thank you. So after Karthik's presentation, we're going to go straight into your Civic Engagement Coordinator presentations. On the next slide, I'll just do a reminder of what we were asking on that front. It's sort of a brief sneak peek of a profile of your site. So we're going to get through most of those in the morning portion of the agenda. And then at lunch, we're fortunate enough to have Monica Pham, who's a staff member to CAPAC, who's going to be talking about the Congressional Asian Pacific American Caucus's role and how what we do at AAPCHO and in our communities and civic engagement work connects up to CAPAC's work. And we also have Kelly Honda, who's the policy manager at NCAPA, the National Council of Asian Pacific Americans, who's going to be joining us and talking about the work and role of AAPCHO at the NCAPA table and how that's also a vehicle for civic engagement and advocacy for API communities. federally. So then we're going to move, that's our lunch, so it's a bit of a working lunch with the presenters there, but our consultants and guests will also be joining us for lunch. So in the afternoon is really kind of us diving into more workshops and roundtables. So we will be, the consultants, I think we've mentioned, there are a few consultants that the Coulter Foundation has on a retainer who are available to work with us collectively as a group and or individually at your sites. And this is going to be a chance for us to not just briefly introduce them, but allow them to showcase a little bit of what they offer, and then for us to do some breakout groups so you can really get a chance to tap their expertise and see if that's someone that you'd like to work with continually in the future. I will say that we're still sort of pioneering the relationships with the consultants, so we'll be providing all of you with kind of an evaluation form ongoingly because we want to get sort of live feedback on how useful or not they are being to your sites and what else you're looking for in terms of that technical assistance. But so George Christie is from State Voices, and Christine Chen is from Asian Pacific Islander American Vote. They will be talking in the afternoon and doing a roundtable on understanding the VAN files and voter analysis. So how do you plan, how do you look at data on voter turnout, and what does that mean for the lists that you all are developing and how active your voter population is in your area. I've had a lot of questions about what does the VAN look like and what does analysis look like on it. So they're going to be going over that in depth. And then Lindsay Holden from Nonprofit Vote and Mark Weatherhorn will be teaming up to do a piece on effective messaging infrastructure in your health center and list development. So for those of you who still had questions about how do I cultivate my list of community health center advocates, whether they're eligible to vote or not, what is good messaging for frontline staff, how do I make sure I'm being aware of and explicit about HIPAA regulations and navigating that line and articulating that to your frontline staff, and do you have a good infrastructure for hosting this kind of civic engagement capacity building plan at your health center. And then lastly, John Miyasato will be the third consultant for us doing a roundtable on really field planning. So John Miyasato has worked with For Freedoms, has done a lot of work in Arizona and throughout the Southeast on campaign planning and field planning. So he's kind of emerged as a bit of our A to Z guy for civic engagement, and he's going to be doing an opening presentation on what he brings to the table, what he can offer, and some good examples of coalition leveraging and building with different types of community-based organizations. So that's really our afternoon is kind of a chance for you all to work together and to get to know a little bit more and dive into these content areas. And as more emerge, I think we'll be noting those for future CEC training calls and or arranging for on-site trainings for these folks to get out to you, and that is built into Coulter's expense, so that does not have to come out of your operating budgets for the Civic Engagement Project. So we'll be closing out the day, and we of course have, I think we want to make sure there's ample opportunity for you all to prepare for the Wednesday and Thursday visits, which Heather will explain next a little bit more about. But at the tail end of Monday from 5 to 6, we're going to ask folks, our policy team will be offering some office hours, so we'll be working with groups, particularly some of the larger groups, those of you from California and Hawaii who are on the line. Your congressional visits are going to be quite large, so we need to make sure you're coordinated together in terms of speaker order and stuff. So we'll be taking a little bit of time after the meeting to just organize some of the larger groups, and for those of you who want just a little bit more technical assistance and support, will be available for that after the meeting. And then we'll be closing it out with a fabulous dinner at 6:30 where we can all relax. There's no working agenda for that meeting other than just you all getting some time together to get to know one another better. So this is kind of what Monday looks like, and I'll be sending all of these details to you after this call. I'm going to pause there for a second in case folks have any questions about the Monday agenda. Okay. Stop me at any time if you do, no problem. Just a few reminders, again, that we're going to start at 9 a.m. on Monday, and thank you all for coming in late Sunday, and I know Sunday's Mother's Day, so it's a big day for a lot of folks, and we appreciate it greatly. And I know many of you are traveling, so this is already a given, but just remember to please bring your current photo ID, your driver's license or passport. You're going to need that for the White House Summit entrance and then your congressional visits with security. And lastly, I think I wanted to remind folks of your civic engagement presentation. So each of you will be bringing and sending us, so what we've asked is that you provide a 5-slide maximum overview of your projects, and this is kind of the sample template, but just an overview, brief overview of your organization, where you're located, and then your current civic engagement activities. And the new ask is here that we'd like for you to just include in your presentation what your current metrics are from your most recent report. Hi, Xiaoqi, I think we can hear you. I can't hear anything. Xiaoqi, can you hear me? Okay. I'm going to keep going, but Xiaoqi, if you can't hear me, then you should chime in, or you can chat us a question in the chat box. But again, just want to make sure that you guys include in your slide presentations your current metrics, so how you're doing on voter registration, how many voter registrations have you completed, and or for those of you who've had a chance to do the list development or committed to vote, pledge to vote numbers. If you have those distinct numbers, you're welcome to report those as well. This was a request from the Coulter Foundation. They just want to get a glimpse of where everybody is at in their current metrics, and understanding that it's been a bit of a ramp-up start. And then just a summary of even just successes that you've had, great things that you're learning, best practices from the field. And then we do want to hear the challenges. The consultants are in the room, so I think it's great to lay out specific challenges that you're facing right now. This is going to give them a little bit better guidance on how to plug in and assist you all. And then any key events for you scheduled in 2015. Some of you, I think maybe 6 of you, have local municipal elections in 2015, and others, our other asks have been just that you all consider and begin thinking about events that are really going to land during National Health Center Week in August, or around National Voter Registration Day in September. So if you've already had some thinking about what's going to happen for you around those events, we'd love to hear a sneak peek of what's to come. Any questions about just the ask for the presentations? On our end here at AAPCHO, it'd be very helpful for us to have your presentations in advance, because we are going to be on a tight schedule at the event. So our goal was to, if we could, ask you all to please send Bev your slide presentations by Wednesday next week, and we'll have those ready and uploaded to go when you're there on Monday. Just please keep us posted, or we'll follow up with you if we don't hear from you by Wednesday. But we're just trying to avoid uploading on site to save us more time. Okay, so with that, I'm going to go ahead and turn it over to Heather now, our policy analyst from the DC site, to talk to you more about Civic Engagement Week on the Hill.
Yay!
Yay!
Awesome. Can people hear me? Yes? Yeah. Is that loud enough? Should I get closer to my computer? Are we all good?
A little bit closer.
Okay. Is this better?
Yes.
Okay. Awesome. Thanks, guys. Again, let me know if I need to speak louder or quieter or anything like that. Okay, so we're all getting ready for this AAPCHO 2 days on the Hill during the Civic Engagement Week. If we can go to the next slide. So today what I'm going to be doing is giving you guys a policy update, going over a little bit over the meeting schedules, what we have so far, and also the strategies for the meetings, going over just the generic what a Hill visit looks like, some of our current asks, and then what you can do now to be preparing for these the Civic Engagement Week Hill visits. And then just a reminder that on the phone and even broadly with our civic engagement work, we have quite a wide range of just relationships with congressional leaders, congressional visit experience, and, to be honest, political realities. So this is a somewhat broader presentation, and then the idea is that we can work with you via the different meeting schedules and strategy, as well as in person, to kind of personalize for your situation specifically. So very much already open to following up on any of this stuff next week for more specifics, as well as in the first couple of days of the Civic Engagement Week as needed. So going into the policy update, the next slide. So these are the things we're going to be focusing. I'm going to give you a policy update and talk to you about our May priorities. And again, before I go into this, this is just a little bit of background context for your meetings. The most important part of the meeting is going to be discussing the local impact of each of these issues. Okay. So going into this, that first follow-up, sorry, the next slide. Okay, is that primary care cliff was prevented. Woohoo! Yeah! Good job, everybody. We did a really good job. HR2, the Sustainable Growth Rate legislation, which included the 2 years for primary care cliff and the Children's Health Insurance Program, that was passed. So the bill became a law. The president signed it. Everything is awesome. So we're very happy about that. So the next slide, we do have a couple bit of follow-ups on that. Oh, so next slide is what this means for Asian American Pacific Islanders. That means we sustained funding for safety net health centers like AAPCHO sites, the Children's Health Insurance Program, so 1 in 4 AAPI kids who relies on Medicaid or CHIP is there. Sorry, can we get to the next slide? Okay, yeah. So this means for AAPIs that we sustained funding for health centers and for CHIP, and that's important for the 1 in 4 AAPI kids that relies on Medicaid or CHIP, and we work to stabilize the Medicare payment.
Sustaining funding for safety net.
Yes. So the next slide is, however, take a second to look deeply at this graph. However, $1.5 billion in discretionary funding is still left to secure in the appropriations process. So if you'll see on this slide, the longer bars are the longer dark blue bars are the mandatory funding through the Health Center Fund, and the shorter light blue bars are the base discretionary appropriation. So what we have secured is the dark blue mandatory funding through Health Center Fund. However, what the arrow is pointing to right here at FY16, the 1.495, that's the base discretionary appropriation, and that still needs to be secured in the appropriations process. So we still have messaging that there is still a little bit of work left to do to fully prevent this primary care cliff, and we still need this 1.495 billion, and that works to backfill the 330 grants. Okay. All right. So that is the update on HR2. Next slide. Okay, so the new thing we're working on, there's always new things to work on, right, is the Health Equity and Access Under the Law, HEAL, for Immigrant Women and Families Act. This is really exciting legislation. It was in last Congress. It was reintroduced last Wednesday, Earth Day, and it has about 32 co-sponsors and counting, and that's actually more than it had total at the end of last Congress. So it already has more. It's got a little bit more momentum this year. It's very important for our community. And this legislation removes the 5-year bar for Medicaid and CHIP. It allows persons with deferred action status in the ACA exchanges, as opposed to currently they have to seek private insurance, which can up the cost. And then it really important for our community, restores Medicaid eligibility for COFA migrants, and that is citizens of the Marshall Islands, Federated States of Micronesia, and Palau. Next slide. More specifically, what the HEAL Act means for AAPIs is that eliminating the 5-year waiting period for legal permanent residents would better meet our community's needs. We know that our community relies on Medicaid, obviously. So we have about 1 in 10 Asian Americans, 1 in 7 Native Hawaiian Pacific Islanders, and 1 in 5 Southeast Asians on Medicaid. So eliminating that would be even more meeting our community's needs. COFA migrants need to have restoration of their Medicaid access. Currently, providing for COFA migrants not providing for COFA migrants does not eliminate their need for care, and so that cost is passed on to either the migrant family themselves or the states they're in, or the health centers. So we need to be working to give them Medicaid access. DACA access, the Deferred Action for Childhood Arrivals program, are actually barred from the exchanges, and that letting them into the exchanges is incredibly important to the Asian American community. So 1 in 8 Asian American immigrants is undocumented. And then for current DACA applications, among the top 15 countries include South Korea, the Philippines, and India. So our community can greatly benefit from DACA access to the exchanges. Next slide. Okay, another current issue is appropriations. So that's money. That is getting funding for things that we need. So we're in the annual budget process. We're in markups. That means that current negotiations for the budget are in the different committees. And the current priorities we're focusing are the $1.5 billion that I discussed earlier, and that's in discretionary funding, and that's part of sustaining the $5.1 billion. And we're also looking at $62.8 million for the CDC Division of Viral Hepatitis.
Heather, it's
Yes.
Jen. Just real quickly, we had a question, just whether or not the slides would be available after the presentation today. So I just want to say yes, we'll make them available, and then Heather's going to probably speak in a few minutes about a briefing packet that you'll receive. So.
Oh yeah, definitely. So you guys are going to get information on Monday. That's going to be your schedules, well, what schedule we have at the moment so far, and the presentation, as well as some of the one-pagers on these issues specifically. So again, you don't have to be memorizing this or taking extensive notes. This will be out there for you. This first section is just to give you a background before we go into what you can ask in the meeting. Okay. So don't stress, no stress about this. Okay, so appropriations. Okay, yeah, $1.5 billion for community health centers and discretionary funding, $62.8 million for Division of Viral Hepatitis. Again, we will have one-pagers on hand for you guys to have those. You don't have to memorize that. Again, the most important part is talking about what this means in the community. Okay, so the next slide. So appropriations. And this money, where does that money go? So the money that we want, what does it do? So again, that $1.5 billion for community health centers is helping to backfill the 330 health center grants. So that is just giving essential community funding to health centers. So talking about that is talking about why health centers are important to communities. The $62.8 million for CDC's Division of Viral Hepatitis is actually going towards sustaining current efforts, which are the viral hepatitis coordinators. There's about 1 in every state, and they coordinate the viral hepatitis effort on the ground. And they also go towards developing a prevention, awareness, and linkage to care strategy. So currently, DVH does not even yet have funding to really develop a full strategy on prevention, awareness, and linkage to care, which is really sad given the state of viral hepatitis. This would also go towards programs to eliminate mother-to-child transmission. Since that is preventable, given education and information about that, we can work on that. And I also want to note this picture is Elmo testifying before the House Education Appropriations Committee about school music programs. And that's just a thought about thinking about, like in clinics, who's a good messenger for talking about these issues and these needs. And that's what you guys are. You guys are going to be doing that. So next slide. That's where the money goes. And then, sorry, this is about what this means for AAPIs. So we know that the $1.5 billion for community health centers is about providing that public health safety net for our community, and that we provide those essential services, and that's helping to sustain our efforts. For viral hepatitis, we know that 1 in 10 Asian American Pacific Islanders has Hep B, and 50% of hepatitis B cases are from our community, even though it's a vaccine-preventable disease. I know a lot of you are very familiar with this stuff. This is just that we need to be making the case continually that these all have a meaning for AAPI communities. And again, the majority of those cases being from mother-to-child transmission. So continually communicating not just our priorities, but what they mean for Asian American, Native Hawaiian, Pacific Islanders. Okay, so the last priority, next slide, is the medically underserved area and health professional service area criteria. This may be one of the wonkiest, like the most nerdy, complicated slides and issues that we have, so if it is a little bit confusing, we can always follow up and give more information for sure. So the designation MUA and the designation HPSA, so that's for medically underserved area and health professional service area, those actually impact how the placements for National Health Service Corps members and loan repayment recipients impacts the placements of those personnel. And that criteria for MUA and HPSA does not include taking into account language access. So basically the current criteria finds areas that have big language access challenges not as medically underserved as if they could be. And that is partly because the criteria has not been updated since the 1970s. HHS promised to release updated criteria in December 2013, but obviously that was a while ago and we haven't seen anything yet. So the next slide is, again, what does this mean for our AAPI clinics? Basically, by not taking into account language access, HHS is not acknowledging the challenges in serving our communities, and it's not adjusting since the 70s to what it means to be medically underserved currently. So if they really adjusted their criteria to include language access, our clinics would have better scores, and those scores would mean that we would be gaining National Health Service Corps members and loan payment recipients. And that would have an incredible impact on how we can serve our communities with more staffers, everything like that. So the last slide is a summary again. So that's the main priorities are following up on HR2 sustainable growth rate, getting more co-sponsors for that HEAL, health equity and access under the law for immigrant women and families, appropriations for community health centers and viral hepatitis, and asking that the MUA HPSA designation be updated.
Hi Heather, it's Jen again. I just wanted to also chime in and say that these are clearly some of the key priorities that AAPCHO has identified for the policy agenda, and then of course bringing your local issues into play will be really critical in this opportunity you have with your congressional members. So it's not to exclude other priorities that you may have emerging from your local regions that you want to also raise.
Oh, yeah. For sure, for definite, yeah.
Yeah, and I didn't know if Tu was on the line, but there are some interesting things happening around the MUA while we're in DC that week. Tu, are you on the line? Okay. If not, I'll just provide an update, but I think there's going to be some follow-up presentation on the MUA criteria, but that's something, as Heather noted, that's been really essential for the API clinics to better designate with HHS. So back to you, Heather. Thanks.
Awesome. So yeah, as Jen is saying, we have the role of taking these priorities and educating Hill staff and legislators about the issues in our communities and suggesting solutions. So yeah, that's the end of the update of the current policy context. We're going to go into the asks and what we're actually asking in a little bit, but I'm going to take a second and cover sort of the meeting schedule. And remember, again, you don't have to memorize all this stuff. You don't have to know all this stuff now. The focus will come more naturally when we talk about what makes sense for your specific area. So going on to the next slide, when we're looking at scheduling meetings, we're we're looking at who represents you, right? So, DC 101, obviously there's like 2 senators per state, 1 representative per congressional district. Some of the clinics have multiple locations, so some of them have multiple representatives. Also, we have gotten meetings with the Congressional Asian Pacific American Caucus staff, and so even though some of them don't have clinics, AAPCHO clinics in their areas, as a caucus, they need to be representing the entire needs of the Asian Pacific American community, and that's the leadership role they've allowed them to take it on. And then congressional leadership, so people who are on committees, while technically they have their own districts, they should also be representing the entire appropriations needs and the entire, health, education, labor, and pension needs if they're on the Health, Education, Labor, and Pensions Committee. And then partisan leadership. So we've got from different, we are reaching out to some areas to get some more partisan leadership. We do have a meeting scheduled with Pelosi's office because as congressional leadership, she should also be representing the fuller needs than just in her specific area. One tiny note for the Senate meetings, or the 2 senators per state, because the Hawaii and California Senate meetings will be quite large because everyone from Hawaii is going to be invited to all the Hawaii Senate meetings, same thing for California. We'll be in contact to coordinate that next week so that we can kind of coordinate that a little bit more in advance. Okay, next slide. So here's an example of the reference sheet and schedule that you will all be getting for your meetings. Again, this is a reference. This is not specific things you have to do, memorize, anything like that. We just want to put it all in one place for you to refer to. So going through this quickly, I know there's a lot of information on one page here. This is for Asian Services in Action. Woohoo, Ohio, yeah. So the left column is the different Congress people you will be meeting with, and in red is like what they represent. Yeah. So if it says Ohio District something, that's obviously a representative. If it's Ohio Senate, then that's for the whole state. CAPAC is the Congressional Asian Pacific American Caucus, and then House leadership. And as we hopefully get more of the partisan meetings along, that's who that represents. One note is, even though on the left is the representative's name, when you look under the logistics, and that should be pretty self-explanatory, when the person's name under logistics is the staffer you'll be meeting with. So, when you go into the meeting, you're going to have to ask, even though you're in Marcia Fudge's office, you're going to meet with Jacob Gelman. So just to make sure that you're getting the names and everything right. The phone number is on there because if you're running late, you definitely want to be calling ahead and letting them know. And then in terms of the different House and Senate buildings, one of the things we'll be sending out either in advance or when you get here is a map of where things are. And in terms of timing, you do want to make sure and get there a little bit early. That's just best practices. Background notes. So that's one thing that your DC policy staff can definitely help and provide is who is currently signed on to different things, what their different committees they've signed on to, things that they've introduced in the past that are useful, who they represent, if they voted across party lines for a different thing, well, we want to make sure and emphasize that. And then that is sort of how we give suggested asks and focuses. Again, this is suggested. This we'll go into how to do the meetings in a second, but this is sort of just thoughts for the different meetings. And so this is for you to understand that the different meetings will be different, obviously, based on the different backgrounds. Yeah, that's about it. So yeah, on here you can see, for example, in the Ohio Senate, 2 different people you're going to be working in 2 different ways with them. So Sherrod Brown is very much a leader because he introduced the CHIP issue. So you definitely want to thank him for his CHIP efforts and what that means for children's health for our community, and talk to him about appropriations because he's in the Finance Committee. However, when you look in the Ohio Senate, Rob Portman, he's not always supportive of CHP and AAPI issues, but he did vote for HR 2 across party lines. So we definitely want to be thanking him for voting for HR 2 and talking about what that means for our community and just letting him know we're watching and we want him to keep doing stuff like that for our community. So hopefully this is going to give you a little bit of perspective on what to just focus on for the different meetings. We are going to, like I said, we're sending out drafts next week. Because of last minute changes, the final copies will be available on Monday the 13th when you get here. But we're going to be sending out drafts next week so you can kind of get in your brain and think about how to talk about these different issues. And then as you'll note in purple, some of the meetings are going to be larger, like KPAC and the House leadership, and we've invited everybody who's coming to these meetings. And by that we mean one person per clinic because there's 13 clinics, plus we might want AAPCHO staff in those meetings. So to not overwhelm people, we're going to be doing about one person per clinic for the KPAC meeting and the Pelosi meeting. You know, you're internally free to determine who's the best person for that. We're probably going to be meeting up Monday afternoon before dinner to be just kind of all put our heads together, the one people per clinic who are going to those meetings, to put our heads together to make sure we're all kind of on the same page with what to do, what to say, how to be, and everything like that. I know the meeting schedule is a little bit like one of the things that people get very ready to know more information about. Do people have any questions about meeting schedule before I go on to the Hill visit and asks themselves? I'm seeing a question in the chat box from Andrew. Correct, yes, we had updated for the San Francisco Bay Area. Is this for NEMS? Andrew?
Yes.
Okay, yeah. Then yeah, you have meetings with SPEAR. You have a meeting with SPEAR and then your two Senate people, and then you obviously one of the people who is your congressional leader is Mike Honda, but because he's part of KPAC, you're going to be part of that meeting. Yeah, so we've adapted that. Okay, well, hearing none more, but obviously feel free to follow up later in this conversation. I'm going to move on to the Hill meetings themselves. Next slide, please. So this is a Hill meeting. So general Hill meeting, how that generally goes is you introduce where you're from, you discuss the policy issue, both what it is and what it means locally, you say what you're asking, and you provide a summary, close the meeting, and follow up. The next slide, though, is the most important part of the meeting. So like we keep emphasizing, the most important part of the meeting is the local impact, the big circle there, and the follow-up, that's that big circle there. Just continuing to remember that you have Isha and I as DC staff who are here all the time and are pretty close here to be, if we need to do a deeper dive in some of these policy issues, we're around. But having you guys here is really about making sure, driving home the local impact of these issues and following up to build that relationship. So we're going to go really quickly into each of these 5 bits. Next slide. Okay, so you're going to do a quick introduction of AAPCHO in your clinic or clinics. It's easy to kind of for this to get long, especially if there's multiple clinics in one visit. Basically, you really need to be communicating who you represent and why this staffer should listen to you. So there's an example phrase. I would suggest practicing keeping it short ahead of time. I know because we're all passionate about this subject and we want to talk with somebody who will listen about all the different things we're doing, but that can get long. It's also good to know that you're there with AAPCHO so that when we follow up, we can be part of that. And to note that as AAPCHO as a whole, we're serving 25% of medically underserved AAPIs. The idea that, like, as a whole, we really do have a voice on telling you what's going on in the community. Yeah. Again, keeping that to 3 to 4 sentences is really good best practices because you want to move along to the policy issue. But because there is information you want to get out, it's nice to practice and have that like down flat. Okay, the next slide. All right, the discussion about your main policy issue. So like you saw in the schedule before, that will depend, right, based on the dynamic, the political reality, whatever the congressional leader has done before. So you're really gonna, this is when you start to focus in on why you're there. So you just, oh, we're here to talk about X, Y, Z. It's nice to ask the staff if they're familiar with your clinic. And also sometimes staff are able to go back into, they visit their district occasionally. And so it's really nice to be able to say, oh, you can always stop by our clinic and tour around if you want to. Again, focusing on one issue or ask gives you more time to give the local perspective. And again, you're going to have, for the main policy issue, you are going to have on hand these one-pagers that are a good reference on key issues, so you don't have to memorize like specific numbers, for example. Okay, so next slide is the local perspective of the policy issue. This is the key element of the meeting. This is the most important part. So for whatever main policy issue, this is starting to share the story of how this has impacted your clinic and your patient population. So like any good storytelling local perspective, as personal and specific as possible. Obviously, like don't violate like HIPAA, right? It's about talking about real consequences for real patients, framing the story for the audience. So depending again on the political reality you're working with. If we're talking about, we're going to talk later about how to talk about some of the immigrant health issues for different audiences and things like that. But when you look at some of the background, or when you even think about your background relationship with these different Congress people, thinking about how to frame the story is really important. And taking next week to kind of think and practice that story to ensure it's delivered smoothly is really good. Next slide. And then, so next we're going to go, into the next thing you're going to do after you talk in general about what this issue has done in your area. Before you suggest a solution, and before you say, here's what we suggest, here's the ask, give the staffer a chance to respond or comment. So they may say, oh, we completely agree, but we can't do this, or we think you're this, or have you thought about this? So definitely give the staffer a chance. And again, focusing on one or two asks is important, and that depends again on the relationship or the meeting. And always frame the ask as a solution to the challenge at hand. So this is also useful if you're asking something that they may not be able to do. So frame it as how you and that staffer or that representative can work together to serve our greater community and the community that they're supposed to represent. But this is a good time to remember that some of the offices may still need to be educated on AAPI health needs. That may be something that they still have yet to understand or really dive into. And then some offices may already be strong advocates, and they may have been the ones to introduce some of this legislation. So your ask may be, how can we work to do even more? What can we do next and amplify this for our community? Okay, so I'm going to go into the asks now. So next slide. Also, so quick review. These are our main priorities. Sorry, I just realized I skipped a slide. So next slide is the main priorities. Okay, cool. So again, these are the main priorities. This is the same slide we had before. Sustainable growth rate, MUA HPSA, HEAL, and appropriation. So the next slide is HEAL. Next, can you get the next slide, please? Okay, so HR2 asks. So we're going to have on there, if they support HR2, you're going to give a genuine thanks, and accompany with that with what it means for your clinic. This is especially important if, for example, they supported HR2 across party lines. Definitely make sure that we know that they did a good job and that it means a lot to our clinic. if they did not support H.R. 2, and I think only a couple of you have this. I think it looks like only 2 senators, Cruz in Texas and Perdue in Georgia. Only 2 of you guys are 2 clinics are going to be visiting people who did not support H.R. 2. That might mean they need some more education about the healthcare needs of medically underserved communities. So that might, maybe your first and only goal there is to just start the conversation about understanding AAPI health needs and whether clinics see on a daily basis, and that's an okay goal. It's an okay ask. Okay, next slide. Okay, HEAL. That's the health equity under the law. For immigrant women, and families. So if you're meeting with a current co-sponsor, and again, we will update you on who's the current co-sponsor at that time. It'll be on your reference sheet. You can give a thank you. You can offer to work on an op-ed together or have them visit your clinic. So that's a chance to say how they can be an even greater kind of advocate for our needs. Even if they are a current co-sponsor, we do want to make sure they understand the issue of the COFA migrants and the fact that our community does need the DACA access to the exchanges. So just making sure they do understand those issues, even if they are a current co-sponsor. So yeah, a lot of you will be meeting with current co-sponsors. Actually, it looks like we have about 6 or 7 people that you'll be meeting with that are current co-sponsors. If the meeting is with someone who's a general supporter of immigrant issues, but they have just not yet co-sponsored HEAL, gotta ask them to sign on. And again, making sure they understand the intricacies of the COFA and DACA issue. And again, because that is definitely intricate, definitely let us know if we can spend some time offline clarifying any questions you may have. But again, making sure they understand what COFA and DACA access to healthcare means, and a lot of you are actually meeting with folks in this bucket. And then lastly, if the meeting is with an office that's pretty hesitant to sign on, or you're anticipating they'll be hesitant to sign on, you can sort of discuss their concerns, and you can talk about the impact of a healthy workforce on the U.S. economy. You can point out that denying coverage doesn't eliminate the need for health care. And we can talk about the fact that immigrants are contributing tax dollars to those programs already. So if you're in that situation, if you're meeting with an office hesitant to sign on and you want to talk about HEAL, definitely let us know if you want to talk even more offline about messaging of that. It can be tricky, and we can definitely go into that more. So next slide.
Heather, it's Jen. I just wanted to clarify too. In the I know because we're about at the 10-minute mark for the call. If folks will also receive a summary of all the asks in preparation, and in the interim you'll receive these slides too to review, because I know it's a lot of information.
Definitely, for sure.
Okay, all right. I'm going to just time check you in about 5 minutes. I want to make sure we have time for questions.
Yeah, we'll move this along pretty fast. Okay.
Right, no problem. Thanks.
So, okay, appropriations asks. So this is really if you're meeting with someone on the appropriations committee. That'll be noted, and you're going to discuss the 2 asks, which are viral hepatitis and funding for community health centers, and what they mean for your center or district. And if we're meeting with someone in a leadership position, so right now that's the KPAC folks and Pelosi, we're going to talk about what those asks mean for the communities that they represent. And otherwise, you don't have to focus on appropriations, because they probably don't have power over that at this moment. So next slide. And then the MUA HPSA criteria. So this is for people who are already strong advocates for our community. This is us asking them to take an even stronger role in asking HHS to release the updated criteria. So you're going to ask your congressperson to write a letter to HHS to release the updated criteria. Again, this is only if we believe they're already a strong advocate for our communities. So for example, people may have already been signed on and are strong HEAL advocates. And we can provide a draft letter for offices to work with, as well as the KPAC letter that was sent in 2012. And again, if you guys have more questions about this specifically, let me know. Okay, the next slide is just a summary slide. So that's the summary of the asks. This is, again, we'll have also this on your reference sheets. We'll have fact sheets for most of these. And we're here to support you on getting this information, clarifying any information, or strategizing. And then the last part of the meeting is, next slide, is the follow-up. So send a follow-up note. This is really important to solidify what you've asked for in the meeting. Sometimes people get these meetings and then they set stuff down at their desk and go to lunch and forget it. So this should be sent within 24 hours. If people have asked questions and you promise to send along materials, this is when you do it. You can offer them to show them around the health center within the district next and CC me to keep track of the relationships we're building. The next slide is what you should do to prepare. So again, we are sending along the policy information. We're sending along this stuff next week. So you can review the policy information, review the reference sheet we're sending next week, which is also your schedule. But the really important part is to develop your story about how whatever policy issue you're going to be focusing on affects the community that you serve. And stories leave this lasting impression. They provide local context, so that's the most important part. And it's also good to practice your short and sweet intro. That's a good thing to have down flat so you can move along quickly. And I think this is my next slide. Sorry, not the last. And then the last thing that I want to make sure you guys understand, our DC staff, so Isha and I, and all the other people who work on policy here, are a resource for you. So let us know if you want to practice Hill visits, more background on specific legislation issues, or the legislative processes that may be complicated, or anything else. We're here for you. Yeah, definitely. I think that's it. So my last slide has the email on it. Yep. Okay, that's all I have.
Thank you so much, Heather. I know that was a lot of content, so really appreciate you kind of laying it all out for everybody. I just want to open up the chat and the lines for questions that folks may have. Anything just regarding the convening or questions to in response to Heather's presentation. Again, next week you're going to be receiving updated information and packets, and then when you arrive, we'll also have that same information for you assembled in folders. So you'll have to bring that information with you. We'll have it for you as well, but just for your background knowledge. And we'll go over that day-by-day breakout. Monday is a packed agenda, but at the end we'll be going through the schedule of events as well. So any questions? I know that one question I've received, so we had some last-minute changes in attendees for the White House API Summit on Tuesday. So we are working with the WIAPI office to make sure we get folks who were late registered and on a wait list in together with us as a group. So that event is very overbooked. So we're going to have an early departure on Tuesday morning to get to the venue on time. But we'll need to enter as a group. So we'll be giving you guys more instructions in DC. So just a reminder, I know we have a lot to cover in between now and then, but our next Civic Engagement Coordinators call will be scheduled for Friday, June 5th. And that's the same time, 9 a.m. Hawaiian Standard Time, 12 Pacific, and 3 Eastern. Great. Okay. So if there are no questions, we'll leave the line open just for a little bit. In case there are questions, feel free to send them in. Heather and myself are available to respond to anything now. And then also wanted to encourage folks to please feel free again to contact Heather directly for any just one-on-one support or clarifying questions once you have time to look at kind of the agenda and as you're preparing to come to DC. Okay, so we'll leave the line open for questions. Otherwise, that's our call for today. Thanks so much.